To all who are new here, welcome. Due to COVID-19, we have moved our regularly scheduled in-person journal clubs to an online platform. Fortunately, our fearless head of the journal club and liaison with the VOC, Brittany, has been working diligently to ensure that we are able to provide these educational opportunities successfully. We have over 200 athletic trainers registered for today's webinar. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. For all athletic trainers who are intending to get live CEUs from the BOC, immediately after the webinar, complete the quiz, which will become available once the webinar has finished. In order to access the quiz, you must remain in the webinar until it closes. 1 hour after the webinar concludes, you will be emailed a link to the evaluation and assessment. You will have 24 hours to complete the assessment. Once you've completed the quiz and the assessment, you will receive an email with a link to download your statement of credit within the next 2 weeks. This is a new process that we are currently implementing. If you have questions during the webinar, please submit the question and we will review the questions at the conclusion of the presentation. So I am thrilled today to announce and introduce our speaker. Dr. Yuka Tsukahara is speaking today from Japan. She completed her medical school training in an orthopedic residency in Tokyo. She completed a sports medicine and spine research fellowship in Emory, Atlanta. She has also performed multiple externships at the New York University Hospital of Joint Diseases and the University of Pittsburgh. Her involvement in sports medicine has been extensive. She is currently one of the Tokyo Olympics Athlete Village physicians, a team physician for Japanese track and field, an affiliate physician with the Women's Japanese Football Association national team. She has also been a speaker at both the American College of Sports Medicine and the American Medical Society for Sports Medicine. She is an avid runner herself and has 2 beautiful children who are currently sleeping as it is right now 5 a.m. in Japan. So I'm going to go ahead and transition the screen over, and we will have her take it away.
Good morning from Japan. Thank you so much for the introduction. I really appreciate it, and thank you so much for this wonderful opportunity. I would like to start my presentation now. I hope you can all see my screen. So the talk that I'm going to give to you all is about the research that I've been doing for the past 4 years, I suppose, on elite female track and field athletes. And the title is a bit long, but performance, physiological, and psychological changes in elite female track and field athletes transitioning to senior. Okay, I have no conflicts of interest. And before I start with, well, due to COVID-19, we cannot call it 2020 Tokyo Olympics anymore, although it is, we do still call it 2020 Olympics, but it has been postponed, as you may all know. And we built a very big new stadium in the middle of Tokyo, and the other picture that you can see down below is what their athlete village looks like. And inside the village there is a clinic which I was supposed to work in from the beginning of July until the Paralympics, which is the beginning of September. And as you can see, they're all brand new. They're all brand new and very nice, but due to COVID-19, all of these are going to be postponed. And our governor in Tokyo was actually thinking of changing this to a COVID-19 place, but luckily we haven't had any that much of COVID-19 cases so far, so it still looks as it is right now. So we're hoping that this will not just turn into a new fancy building, and we can use this as an athlete village next year. So fingers crossed. If you think of the sports in Japan, I'm pretty sure a lot of people will think about karate or judo or sumo wrestling. But the reality is actually not like that. Although, yes, sumo wrestling is pretty popular, but not among young people. I would say for older people. I've only been to the game once, but that was because I had a friend from the United States. And judo is pretty popular, but I think it's getting more popular in Brazil or in France. So as you can see from this chart, the common sports in Japan are not the ones that I just shown you in the previous slide. For boys, it's always been baseball and soccer, and for girls, tennis and volleyball. And especially baseball and soccer is very popular among boys in Japan. And I'm actually not really proud to say this, but I know that early specialization is a very hot topic in the United States. Our boys and girls start way early. In some sports, they start from like 3 or 4 years old, and the other thing that is unique about Japan is that once you pick one sport, you kind of do that for the rest of your life. So that's why we do have a lot of injuries. And as I was mentioned before, I do work for Japanese track and field and women's soccer. So, and compared to the US, our track and field team are not that good, but we did win some medals for race walking and for 4x100 men's relay. And for the women's soccer team, as you may know, we won the World Cup in 2011 against the United States, but 4 years after that, we lost against the US in the finals, but we are still pretty good. And now I would like you to take a look at this. I don't know how familiar you all are with figure skaters, but the Russian girls, they've always been very good at figure skating. And Yulia Lipnitskaya, I'm not sure if I'm pronouncing it right, but she won the silver medal at the World Championships when she was 15. Evgenia Medvedeva, she's now based in Canada, who won the gold medal when she was 16 years old. Zagitova won the gold medal in a few years ago in Korea when she was 15. So as you can see, all these girls, they were top level in their 15s or 16s, and as you can, I don't know if you are familiar with these girls, but Yulia Lipnitskaya, she suffered from eating disorder and she retired when she was really young. And Zagitova claimed that she will take a few years off. So I don't really know what is going on with these girls, maybe eating disorders, maybe injuries, but it is pretty obvious that these girls perform better when they were younger. And this is a huge issue in many sports in many countries. And as for track and field, so this is one of the biggest problems that we are facing right now. So the number of girls who run 400 meters less than 56 seconds were 11 to 19 from the year of 2010 to 2014 in the final year of high school. And if you measure the same, if you could take a look at this graph on the orange bar, you can see that the number of girls who run that fast in the first year of college just goes down to 2 to 7. And people might think, oh, I think it's because these girls stopped competing once they got into college, but actually that's not it. It's because I tracked all of them, and they were still competing, but they were just not able to do better than they did in high school. So our purpose was to examine the relationship between performance and physiological and psychological factors in elite track and field athletes transitioning to the senior division. So this is a picture that was taken on the left. The picture on the left was taken at Asian championships, and they won, I think it was the bronze medal. But for a couple years later, they just cannot do well as they did when they were a teenager. And well, there were a few hypotheses that we thought of. Could it because women tend to accumulate fat after hitting puberty, or maybe they just face stress during adolescence? So what we did was this study was funded by Japan Sports Agency, and we recruited 130 elite female track and field athletes who ranked top 100 in our country. And we were able to analyze the 40 subjects who specialized in the following events. Okay, sorry, it's not working. Okay, all right, here we go. 100, 200, 400 meters to 400-meter hurdles, long jump, triple jump, and heptathlon. And we actually excluded high jump, pole vault, and throwing events because the high jumpers, they are very lean, and I thought it would not be a good comparison compared to the other events that I listed above. Pole vault is more of a technical sport, so that's why I excluded that. And throwing events, they do have a way different body composition than sprinters and jumpers, so we excluded them as well. And we collected data from the postseason of 2016 until 2017 for every 6 months. In Japan, we actually don't have an indoor track season. We do have an indoor track, but I think we only have 1 or 2 in the country, so we don't actually have an indoor track season. So most athletes, they just compete outdoors. And what we measured were the season's performance, training schedules and volumes, mood, attitude toward eating, body composition, and blood markers. And I don't know how familiar you are with the geography in Japan, but so this, all right, let me use this pointer. Oh, sorry. So the smiley mark on the right is Tokyo, let's say Tokyo, and the one on the left is Osaka, and the one in the middle is a city called Nagoya. These are the biggest 3 cities in Japan. So we recruited athletes in these 3 cities. And the picture that I'm showing right now on your right side is my son, who was actually, he was born 5 days after I was doing this measurement. So it was pretty hard for me, and I had a C-section. So I was walking around like a baby because I couldn't really walk that well because of the pain. But these girls helped me out. They were actually my subjects and also my patients. And I'm pretty sad to say this, but they cannot compete at any event because of the COVID-19, which kind of breaks my heart. And the season's performance were using a thing called IWAF scoring tables. Well, we should call it WA because they changed their name to World Athletics. But so what they do is it's kind of a tool that you could measure the performance level in different events. So for example, it's kind of like what we use in heptathlon and decathlon. So let's say you ran 100 meters in 12 seconds, you get like 800 points. And then if you run 24 seconds in 200, then you'll get like, I don't know, maybe around 900 points. So you can compare the different events. So we use this to measure their performance levels. For the training schedules and volumes, we used a questionnaire, a survey. And for mood, we used a thing called Profile of Mood States, which we use a lot. And I will go through this later on. And attitude towards eating, we use something called EAT26. It stands for Eating Attitudes Test 26. And profile of mood states, this is what we use a lot. And this is something that has a 5-point scale from not at all to extremely, which correlates from 0 to 4. It consists of 35 questions, and you'll be able to do this like less than 3 minutes or so. And what it measures is anger, hostility. Oh, sorry. Oh, it's not working again. Okay. Confusion, bewilderment, depression, dejection, fatigue, inertia, tension, anxiety, vigor, activity, friendliness, and then the most important thing is the total mood disturbance score, which is a calculation above from the factors above. And eating attitudes test is a 6-point scale from never to all the time. Sorry, I deleted some of the words here. I'm sorry for the confusion. And it is a tool that are used for eating disorders and disordered eating. For those who scored more than 20, were recommended to see a specialist, but fortunately, none of the girls actually did score above 20. For the body composition, we used whole body DEXA. And for blood markers, we measured the followings, and we actually did measure sex hormones as well, which is not listed here because it didn't not really show any significance. And I would like to explain about the body composition. So there are a lot of ways to measure body composition, like impedance as well, but the most accurate thing that, according to the previous literature, is DEXA. And if you see DEXA, well, this DEXA is like when I tell my patients, I would say like it's like an MRI, but it's opened. It's like an open dome MRI. And it takes less than 10 minutes for sure if you do the whole body mode. I would say normally it takes less than 5 minutes. And the beauty of this is that people might think that there are a lot of radiation, but it's actually less than 10% of chest X-ray. So really low invasive. And of course, you can measure all the bone mineral density in various places: left arm, ribs, spine, pelvis, leg. And the other thing that I really like about this machine is that you can measure your body composition, and in not just in your whole body, but in different part of the body. You know that how much your bone weighs, for example, in your trunk or fat, and how much lean you have. And the other way I use this, I don't use this just for my research, but I also use this for my athletes. We measure them like every 4 months. And for example, if an athlete has the most important part that I focus on are the lean mass on their legs, because if there is a difference more than 5% of lean mass between your right leg and your left leg, there's a tendency to get injuries. Or I use this for post injuries as well, for example, ACL reconstructions as well and stuff like that. But it is a very good tool to predict an injury as well. So when there's an athlete who has a difference more than 5%, I actually tell them to work on their muscle strength. So there's a lot of ways to use this machine, and I use this all the time. And in Japan, even if it's pretty cheap in Japan. I don't know how much it is in the US, but if you're paying out of pocket, it will cost like $30. And if it's covered by insurance, I would say it's like $10 or something like that. And for the blood markers, We did CBC, so hemoglobin, white blood cells and stuff, and chemistry panel. We did a lot of cholesterol things and vitamin D, and also the most important thing about this research is the bone turnover markers. So I'd like to just go through to review what the bone turnover markers represent. So as you know, the continual cycle of bone growth and resorption occurs in our bones. And if you could take a look at the slide on the left, all the time our bones are the old ones are getting broken, and then we build a new bone. So the bone, that's the one on the left, is called bone resorption markers. And in our case, we measured a thing called, we call it TRAP5. It's shortened for tartrate resistant acid phosphatase 5B. And for the bone formation markers, we did TP1NP, osteocalcin, and bone specific alkaline phosphatase, which is called BAP. So if the athlete has an injury for like stress fractures, or if the athlete are super young and they're still in their growth part, these markers will go way up. But luckily, we did not have any during that time. No injuries during that time. So that's one of the things that we measured from our blood markers. And the results are shown here. And actually, this is under publication right now, so I appreciate if you don't post this on social media yet. I'm pretty sure it will be published soon, but it's still not yet. So, and if you could take a look at this, as I mentioned, we measured 40 athletes amongst the 130. And we analyzed 40 of them, and only 15 were able to perform better than the previous year, and the remaining 25 were not able to. So we defined group A as the group that performed better than the previous year, and group B is the group that were not able to perform better than they did a year ago. And their characteristics, the baseline characteristics were actually exactly the same. The ages were the same, the height were almost the same, and the scores were, the mean scores were different, but statistically speaking, there were not any differences. But a year after, well, it was different. And the survey did not actually show that much of a difference between the two groups, or between the year, or between 6 months apart. But group B, the group that did not perform well than they did the year before, had more rest days per week after a year, which is, by the way, not usually 1 to 2 days per week. None of the athletes had rest day for more than 3 weeks a day, 3 days a week, by the way. And this is the most important thing in our research. As you can see, the body mass, there were no statistical there was no statistical difference in all of the season, post season of 2016 until post season of 2017. And both group A and B remained their body mass. They were pretty much the same throughout the year, and there wasn't any differences between the two groups as well. But if you could take a look at the figure B, the body fat percentage, group B had a significant higher body fat percentage throughout the year, after a year, compared to the year they did before. Whereas group A just remained the same. They did not go lower, but it remained the same throughout the year. And lean mass percentage, Well, if you could take a look at this, well, I mean, it might be pretty obvious as you saw the figure of Group B, but so Group B, as I mentioned before, their body fat percentage went up. So on the contrary, their lean mass percentage went down. And as for Group A, they all remained the same. And for bone mass percentage, both groups remained most statistically the same throughout the year. And this was the figure that I'm showing to you right now is the data of whole body. But if you take when I did the same thing in their upper extremity, their trunk, lower extremity, it was all the same. So Group B had lower lean mass percentage and higher fat percentage after a year. And about the result for POMS and E26, the result that was shown in T1, when we did our first measurement, there were no differences between the two groups, but after our year, Group B had higher mood disturbances than Group A. As for E26, from, I don't know why, but from T1 to T2, Group B had a little, it went higher, but after that, it went down, and Group A remained statistically the same throughout the year. And as for the subscales of POMS2, as you can see, Group B had higher marks than Group A at the end of after a year in confusion, bewilderment, and DDs as well. Whereas Group A mostly remained the same throughout the year. And as for the blood markers, the LDL cholesterol, which is actually a measure that you can use for training. If you do intensive training, previous data shows that your LDL cholesterol goes down, and so that's one of the things that we also measured as well. And as you can see, that Group A had lower cholesterol levels after a year, and 25-OH vitamin D, which could represent the amount of time that they spent outside, it went up for Group A. So we speculated that Group A might have spent more time outside compared to Group B after a year. Okay, there we go. Okay, all right. And as for the bone turnover markers, Group A, and when you compare Group A and Group B, Group B had lower TRAP after a year, and BAP as well. And these bone turnover markers, in clinics, we use it for like bone disorders, even in elderly women. But in this case, and in many studies in the past that were done in the past, they actually use these markers as a measurement for training load and training intensity, because if these markers go up, that means that you are training hard and you are giving damage to your bone cycle, and that's why your bone cycle are going rapidly. And this is one of the things that in our field we use to assess the training loads. So as for Group B, that went below after that went statistically lower after a year. So one of the things that I would like to focus on is the Group A had no significant change in body composition. So after a year, even though Group B had a massive change in their body composition, Group A none of the components were significantly different after a year, including their body mass itself, body weight, body mass itself, and their body fat percentage, their fat mass, lean mass, and lean mass percentage. All of those remained the same when you compare them at T1, T2, T3, which are 6 months apart. And so surprisingly, their fat mass did not go below what they did. Let me rephrase that. So their fat mass did not decrease after a year. They just remained statistically the same throughout the year. And as I mentioned before, their vitamin D levels went up. So we speculated that it could be because they spent more time outside, because 90% of the vitamin D reflects the amount of time that you've spent time outside. So it goes up when you when you are brought up in a region with a lot of sunshine, like Florida, I would say. But we speculated that they might have spent more time outside, which maybe it doesn't necessarily mean that they trained outside more. Maybe they were just outside more, but that's what our data showed. And I think this, as for track and field, in our country, most athletes train outside because we don't have indoor track. So we think that they spent more time outside for training, and there were no change in the mood. But I will go through this again for the mood disturbances, but it is hard to say because we don't know if the mood change was due to their performance or vice versa. So this is hard to assess, but there were no change in any of the subscales of POMS 2 in group A. And LDL cholesterol decreased after a year. So like I said before, this is maybe due to training load increase, because previous study that was done in Korea showed that if you do not train for 2 months, the LDL cholesterol just goes up statistically significantly. So we speculated that maybe group A had more training load or training intensities compared to the year before. Whereas for group B, their fat mass itself, body fat percentage increased, and their lean mass decreased after a year. So the other important thing that I want to emphasize here is that their body weight did not change. And the reason why I'm saying this is because a lot of the athletes are there are not a lot of chances to measure their body composition, I suppose. But for body weight, it's really easy to measure. So a lot of the athletes are just really obsessed with their body weight, especially in long distance runners. But even though the sprinters may have lower risk of female athlete triad or relative energy deficiency in sports, the so-called REDs, but even so, they are really obsessed with like how much they weigh all the time. And I'm actually not proud to say this, but even the professional runners in Japan, you have to get on a scale in front of their coaches, and they kind of get punished if they weigh more than the coaches wanted them to weigh. And this is still a huge issue because even though a lot of the experts are saying the importance of proper fueling, it still doesn't work that way sometimes. And even as for figure skaters, I work with them sometimes in my country, and since we don't have a lot of skating rinks, they practice around midnight, and because that's the only time they can practice. So a lot of the 6-year-old or 7-year-old, they go to the skating ice rink around like 9 p.m. They practice around till midnight, and they come home and they train again again around 5 a.m. in the morning before they go to school. So one time I had a girl in my clinic. I guess she was 7 or 8 year old, and when I was talking to her, I mean, she had a knee problem. It was minor, but when I was talking to her, she suddenly she didn't actually fall asleep, but she was yawning the whole time, and it was pretty obvious that she was really sleepy. So I told her, oh, why don't you go home and get some rest? And then her mom said, oh, please don't say that to her. I don't want her to get big, because if she gets taller, she will weigh more. And when she gets taller, she can't do her jumps. And she was actually pretty good. She was able to do all the triple flip and all those triple jumps. But so it was her mom, her actual mom, but she didn't want her to become taller, because she didn't want her to become heavier, because she can't do any jumps. So a lot of the athletes, not just for track and field and not just for figure skatings, but they do focus too much on body weight. But according to my study that we've been doing, the body weight actually isn't is not the thing they should focus on, and I think they should focus more on their body composition, which is not as easy to measure compared to body weight. But even so, I think it is not a good idea for athletes and coaches to focus too much on body weight. And like I mentioned before, their TRAP and BAP, which are the bone turnover markers, decreased after a year. So I think we speculated that maybe their training loads decreased after a year. I don't know the reason, but that's what they showed. So and the other thing was the mood disturbances score, which some of the subscales went up for Group B. And like I mentioned before, I am not sure if this is because they did not perform well and they just had a lot of mood disturbances, or vice versa. They had the mood disturbances and that is why they were not able to perform well. So it's hard to say which came first, but this is what it showed in our data. And I actually did a similar study in the US. I was a research fellow at Emory, and a friend of mine who is the team physician for US track and field. Well, we've been friends for a long time, and I had a grant from the government. I asked him that I am doing a research on female track and field athletes, and I am curious if this could be due to a cultural thing. So I asked him that if I can do something similar to the American athletes. And since I'm not do not have a medical license in the US, I cannot perform I cannot get their bone turnover markers. I cannot draw blood from them, and DEXA scans are way too expensive in the US compared to Japan. So I did not use DEXA scan. I did the impedance. I brought my own machine from Japan. And we measured data from a Division 1 college and Division 3 college in the US, which I thought was, because in Japan, if you say Division 1, that means they have a higher level performance. But I suppose it's not necessarily like that in the US. But I divided the groups for I had subjects from Division 1 group, Division 1 college, and Division 3 college, and I compared these data from our girls for Group A and Group B, and this is how it showed. So the heights were, as of course, the Americans were higher than our Japanese girls, and they weighed more because they're taller. But this was surprising for me, because the fat mass. Oh, I'm sorry. the lean mass percentage, this was lean mass, it says lean mass percentage, but this is actually a mistake. It was the fat mass percentage in their lower extremities. And the fat mass percentage that are written right next to E26, this is the fat mass percentage in their whole body. So, okay, I don't know if this is showing up. I'm trying to use the pointer. Okay, so yes, so this lean mass percentage, this is not lean mass, sorry, this is the fat mass percentage of their lower extremity. So sorry about that. And as you can see, our Japanese girls had a way lower fat mass percentage compared to the American athletes, and their levels were not necessarily the same. I think our Group A girls were slightly better than the Division I collegiate girls in the U.S., but still, I was pretty surprised that the fat mass percentage were way lower in our athletes, because I didn't think it would be that different. But this, according to, and even though we did not use the same machine, it should be correlated. So this was actually something new to me. But the biggest, okay, sorry. The biggest differences between the two groups was, okay, I'm gonna try to get this away. I'm sorry. If you could take a look at the E26 result, it's very different. So as I mentioned before, it's if you score more than 20, that means that it would be better to get help from a specialist. So luckily, none of our girls scored more than 20, but I was surprised how good the U.S. Maybe it's because you've got good nutritionist or a good sports medicine physician, but I don't know why. But this 10-point differences was very new to me. So, and most of the girls actually scored 0 in E26, so they had a very low risk of eating disorders or disordered eating, even though they are performing well. So I actually tell my girls that how the American girls are doing, because all the time they're just constantly thinking about their calorie intake. So, okay, ooh, great. I'm trying to get this away. I'm so sorry. I don't know. Okay, all right. Oh no, sorry. Okay, all right. Oh no. Okay, I'm trying to move to the next slide. Sorry, let me. Okay. All right. Okay, now it's showing. Sorry about that. So the take-home points from this topic is that I'm not going to read all of this, because I think most of you all got the idea of what I'm trying to say. But for elite female track and field athletes transitioning to the senior divisions, most of them, yes, their performance do decline. But the importance is that your body mass itself is not what it matters, but your body composition is the one that you should focus on. And also, it's not that, like, I'm encouraging the athletes to train more, but their training intensities do matter. And I'm not, like I said, I'm not saying that you should train more, but I think you should, in a way, take notes or whatever with what kind of training menu that the athletes did in the past, and compare it to what they're doing, and try not to decrease that much. And we also should tell the athletes who are transitioning to the senior division that this is something that might happen to you. So you need to focus you need to focus not too much on the body weight itself, because that does not have any correlation to their performances. And hopefully the Tokyo 2020 will be on next year in 2021, and I will be working at the Athletes Village and taking care of the actually the foreign athletes most of the time. So hopefully no injuries for your athletes, but I hope to see you all at the Olympics next year. And thank you very much for having me today.
Awesome. Awesome. Well, thank you so much. What a great talk. There are already a lot of questions coming in, so I'm going to just dive in here. So how do you navigate around the cultural feelings of body image when you are dealing with your athletes?
That's actually a very difficult question, but you in Japan, I guess I don't know how it is in the US, but a lot of the girls actually do think that leaner the better. So, for the past couple of years, I've been telling them that it's not always about how it looks, it's what's inside that does matter. So we have a monthly magazine for track and field athletes. So I write an article about that every 2 or 3 months and tell them the importance of the body composition and not the body weight itself, and like just try not to care about how athlete A is doing, because some athletes are like, oh, because she is thinner than I am, that's why she's faster than I am. So I just try to talk to them into that. And since I cannot talk to all of the athletes, that's how I do it. I write an article, and I don't know how much of them are paying attention, but that's one of the things that I do. I don't know if that's answering the question, but yes.
Have you seen a shift in their perceptions since you have started putting out this information and since writing those articles?
I hope so, and I think my subjects were trying to observe that, but actually, I recruited, I would say, like more than 300 or 400 athletes for my study, but I think the problem is the ones who did not participate, because mostly because they actually wanted to participate. It's the coaches that were saying no, like you cannot participate to these kind of researches.
Yeah.
But yeah.
Has coaching been a big barrier, or has there been other barriers that you've found?
Yes, and there are a lot of barriers, especially when I'm not trying to be judgmental or anything like that, but I do have a hard time talking about these kind of topics in male coaches, especially in their 50s or 60s. But even though I just try to give them a talk at like there's a seminar for coaches every 2 to 3 months. So I go there and I give a talk and I try to convince them as much as I can. I'm not sure if that's working, but for young coaches, it is working, and they say that like it was really informative, and I will tell that to my girls. So for the young coaches, I think it is working, but I'm not sure for the older men coaches.
Do you find that the parents are they a barrier here sometimes?
For track and field, it's not that much of a barrier, and some of the parents actually kind of tagged along during the research, and they do ask a lot of questions about the result of the research. So for track and field, it's not that much, but for figure skating, it kind of is. Like I mentioned before about the girl who had a knee injury. So they're at the skating rink all the time, and they're really passionate, but the way they're passionate is kind of in the wrong direction sometimes.
Gotcha. Have you seen, since you started having these talks with the parents in particular, have you
Mhm.
seen that more people have started talking about body composition?
Yes, I would say so because some of the athletes tried to purchase the body composition machine, which the price varies, but you can get a pretty good one in around like 250 US dollars. So I'm pretty sure it is working for some of the athletes that I have given a talk to.
And then what about in terms of what you've seen with sports specialization, and it sounds like maybe parents are very involved with that. Have you seen in Japan that there is efforts to change that mindset, change that approach of sports specialization in children?
Yes, especially in baseball, they are trying to do so, but it's the coaches and the parents, because in Japan, a lot of the time, especially for baseball, the parents are the coaches sometimes.
Mhm.
So it is very hard to convince them because it's the way they kind of think the way they did it works for their kids. So it is very hard, but we are trying not to specialize too early because like I said before, they sometimes like ping pong players, they start like when they're 3, and figure skaters 3 or 4 years old as well. So in some of the sports, they're trying to change that, but in some sports, I think it still needs a lot of time to change that because many athletes actually do perform the Olympians, or the athletes who performed well in their seniors, they actually do start early. So, but the problem is that not all the athletes who start early do well in seniors, but they don't see that. They just see the ones that are performing well in senior, and they, since they started early, why don't my kids start early? So it is a huge issue, and I know we need to focus on that, but I think it's something that is very hard to change from our country because once you do one sport, you specialize that throughout the year. It's not like in the US, like you do track season in fall and you do basketball at some other season. It's not like that. When you pick track, you do track throughout the whole year. So it's very difficult to change that.
Yeah. Can you talk a little bit about the utilization of athletic trainers within the sports medicine team in Japan?
Yes. The athletic trainers in Japan the system is pretty different from what you have in the US. So when I was at Emory, I was surprised because the athletic trainers were actually working in the clinic side by side to the doctors, which is really ideal for us. But in our country, the athletic trainers are not really allowed to do that. So what we have the nurses all the time with us, so we work with the nurses all the time instead of the athletic trainers. So that is pretty different, and but we are trying to change that as well to so that the sports medicine physicians can work with the athletic trainers instead of the nurses, because some nurses do specialize in sports medicine, but that's very limited. I only know like one or two, or no, maybe 5 or 6 in the country. So it will be ideal to work with the athletic trainers in the clinic. So we are trying to change that, and I would say the another difference between athletic trainers in Japan and the U.S. is that a lot of the athletic trainers in Japan are can do acupuncture. So we use a lot of acupunctures as well, and especially in track and field, they do use acupunctures. So I mean, I'm not saying acupuncture is not it's good or bad, but sometimes there are complications. Like pneumothorax happens once in a while. So, but yeah, so that's one of the big difference between US and Japan, the athletic trainers. But I think what they do is pretty much the same. So yeah, I would say yes.
Great. And what about with the different teams or levels? Athletic trainers, are they working in the high school level? Are they working with the different the leagues or clubs?
Yes, for high schools, that's one of the things that I envy about the US is that most high schools don't have their own athletic trainers. I would say only 5% or maybe lower than that, because I think it's because they cannot hire to pay for them. Maybe that's one of the reason. And so that's actually a big problem for our junior athletes. So because once they get an injury, who do they go to? And they just kind of leave it there. So we actually did another survey on track and field athletes in the elite level, and we asked them like, who do you go to when you're injured? And like they say, I just talk to my coaches. And when they come to my clinic, like a couple years after, you figure out, oh, you used to have a stress fracture here. Did you know about that? And then they'll go like, oh yeah, you know what? I had a pain right here in my shin a couple years ago, but I just left it because my coach told me that it's not that big of a deal. So we should have athletic trainers in our high school, but I think that's a very huge change to make. So I encourage them to go to the hospital if you have any injuries. And for clubs, they do have athletic trainers, especially when they have a lot of money. For like the pros, they do. For like baseball, I think they have like more than 10 or maybe 20 athletic trainers. And for college, yes, the same thing. They do have a lot of athletic trainers. And yes, so yeah, the high school is the main problem because they do have a lot of injuries, but they don't really have good access to athletic trainers.
Mhm. Yeah, and I would say that here in the United States, there are state differences with
Oh,
the high schools. Some states, every high school has athletic trainers, and then in Florida, in particular, there are certain counties where so smaller regions that all have athletic trainers. But in my county, where I'm at, most of the high schools do not have athletic trainers. So
okay.
very different even within one state or in different regions. Well,
Okay.
this has been really just excellent, very enlightening. I do appreciate your time. I know it is very early and we're over in Japan, so thank you so much. And yes, is there any last things that you would like to share?
Forgive me if I made a lot of grammatical mistakes. Grammar is my weakest point, so sorry about that. And thank you so much for listening. And yes, as I mentioned before, I would appreciate if you could tell your athletes, especially your female athletes, and try not to focus too much on their body weight, because a lot of girls do. Well, even though the E26 scores were lower in the US compared to us, even so, I would appreciate if you could encourage that to your athletes. And if you have any questions, feel free to email me.
Awesome. Well, thank you. And to everyone, please stay safe, stay healthy. I like to hear that we've got some things that are starting to get in progress in terms of moving forward, and hopefully we will be hearing about Tokyo 2020 in 2021.
Yes.
Have a good day, everyone.
Thank you.